the past few months, we have discussed a number of medical topics. Today, we continue those with Dr. Richard Busch, and this time we are focusing on nerve damage. And you're going to talk about one type in particular, right, Dr. Busch?
It's called peripheral neuropathy.
One more time.
Peripheral neuropathy.
Okay, got it.
That's a mouthful, right?
Yes, it is. Okay.
Basically, peripheral neuropathy, if you just defined as death or damage of a nerve, it's very common, especially diabetics. That's the most common group of patients that we see with peripheral neuropathy. We also see it in patients that take certain types of medications. Some patients may have sensitivities to different chemicals that are in the environment, or even war toxins like Agent Orange. But then along with that, there are also things like chemotherapy that also cause different types of neuropathy as well.
So what are the symptoms of this?
Well, the symptoms are they wide-ranging. They can be anything from just numbness and tingling
like in your fingers?
In your fingers or your feet.
Okay.
A lot of times this shows up in the feet, and in the feet predominantly, and then in the hands. So we see it in the feet first because they're farthest away from our central nervous system, and then our hands secondarily. But then we see things like numbness and tingling. We may see burning or sharp shooting pains. A lot of patients describe it as it feels like they have a saran wrap wrapped around their hand or their foot, and then duct tape wrapped around the top of that.
Isn't it like the carpal tunnel, though?
Well, carpal tunnel is a type of neuropathy because it's damage to nerves, and that's something we can talk about in the future.
Yeah.
But we're talking a little bit more today about just the actual damage to those nerves. And again, the most common group that we see have these types of problems are diabetics.
Okay.
And basically that has to do with the blood sugar levels. It causes a decrease in oxygenation to the nerves, which actually causes damage because anytime anything in the body has a decrease in oxygen to it, what happens to it? It becomes damaged, it starts to die because oxygen is very important for our bodies to live.
Yeah, definitely.
So that's the #1 group that we see, and really the biggest concern that we have with any patients that have neuropathy is the #1 cause of injury in patients over the age of 70 is a fall. But also along with that, one of the top causes of death in patients over the age of 70 is also a fall. So basically, you know, when you can't feel your feet, if you can't feel what you're doing, if you lose your balance, you're going to be more likely to fall.
Right.
And so that's a big concern.
Now, what is your protocol? How do you treat this?
Well, you know, like we talked about last time, we use several different modalities in everything that we do. One of those, we use some low-level light and laser therapy, so cold laser therapy, which actually helps increase the blood supply, increases oxygenation to those nerves, and helps them heal. We're using the right wavelength, the right intensity, and the right frequency to actually have a positive effect on those nerves to really turn them on again. And then we also use different types of nutrition, other types of therapy along with that to actually have a completely full encompassing protocol for the patients.
And you have a toll-free number people can call to get more info, right?
888-471-4090.
Okay, right there, 471-4090. Dr. Busch, thanks for coming in.
Thank you so much.
Great information as always. Ran out of time.
That's okay, I appreciate it.
It's what happens, what we do here. You can find out more about the Busch Chiropractic Center by calling the number that you see on your screen or going to the